Good morning, everyone. My name is Emily Makalo. I'll be your facilitator for today. First of all, I would like to apologize for that 15 minutes delay. But as we continue to go on, I would like to allow me to introduce Daktari and tell you more about this webinar today. The webinar is on breast cancer awareness. It is powered by Britam Health, where our wellness and chronic disease management program focuses on disease prevention and health promotion. Without further ado, I will introduce Dr. Helena Musau. Dr. Helena Musau is a consultant oncologist at Kenyatta University, Teaching, Research and Referral Hospital. She is a specialist in the assessment and treatment of cancer using both systemic and radiotherapy therapies. Without further ado, karibu Daktari. Our participants, please feel free to go on and type in your questions in the chat box and Daktari will tackle at the end. Karibuni.
Asante sana. Thank you very much, and thank you for the invitation to speak to you today. I will start off the presentation if that's okay. Let me just share my screen. So we're looking at Breast Cancer Awareness Month, which is October, and a lot of activities on breast cancer and even just cancer in general take place over this month. So as we're looking to celebrate this month and just create awareness, we figured a talk would be good to the members of Britam. So I will take you through. I have no disclosures to declare. I'll take you through an introduction, then we'll look at some statistics. I'm focusing mostly on Kenya because that's where I am. Some of the risk factors that we have regarding cancer, the myths and misconceptions that we have, screening and why it's important, and then some of the signs and symptoms of cancer, and very briefly look at treatment options that are available to treat breast cancer, and then we can call it a day and answer some questions. So cancer begins when cells in the body start to grow out of control. We have got different types of cells in the body. Cells are the building blocks of the body, and generally what happens is that cells grow, and as they continue to grow, sometimes they die off, either because they have lost their function for whatever reason that is, or they have become, they have gotten a problem within the cell. So the body has a mechanism in which these cells that have either become old or have outlived their function or have got a problem in them, the body has a mechanism in which they are able to take out those cells. But with cancer cells, what you find happens is that they evade that mechanism and continue to grow out of control, and they cause problems, not just where they start off, but they have the ability to spread to other parts of the body and cause problems there. And that is actually what makes cancer dangerous. So when we're looking at breast cancer, it is the most common cancer in women. And you find that the breasts, most people who have two breasts, are primarily made of fat and breast tissue. And with the breast tissue, you find that it's a complex network of different things. We've got lobules, we've got lobes, we've got ducts. And the function of the breast primarily, especially for women, is to produce breast milk and also for cosmetic appearance and also for sexual, it's also a sexual organ. And the breasts change throughout the lifetime of a woman. When we talk about cancer, we have got, or tumors, basically, we've got two different types. We've got those that are cancerous, and the cancerous ones, we call them malignant. And their characteristic is that they're able to spread or invade different tissues and can travel to different parts of the body to form new tumors. And many of the cancers are solid tumors, but we have cancers which are not always solid, such as blood cancers, which are leukemias. Breast cancer would be an example of a solid tumor. Then we have got tumors that are benign, and benign tumors are not cancerous, meaning they do not spread to or invade different tissues in the body. And they just are localized to the area where those cells are growing. Benign tumors can be there for years. They do not have a potential to cause death, whilst malignant tumors usually will spread and have the potential to cause death if not attended to on time. When we're looking at Kenya, the statistics we have for 2020, looking at the new cancer cases in the country, and these figures are probably shy of the truth. We see that breast cancer accounts for 16.1% of all the cancers that we see in the country. That's a huge chunk of the malignancies that we see. And it's both breast cancer in men and women that has been documented here. But when we're looking at in terms of mortality and incidence, what we find is that when we're looking at the Western world, the Asian population, we find that the incidence of breast cancer is high, but their mortality is low. When we come to countries such as Africa, our incidence is high, but our mortality is also a little bit high. Looking at East Africa, where we are situated in Kenya, our incidence would be about 33%, and then our mortality rate would come to almost half of that, which shows that we still have a lot to do when we're looking to fighting cancer in this part of the world. But this is a slide that I wanted to show, that just show you that it's encouraging, and the reason why we need to create awareness regarding breast cancer. Because if caught early, we are able to treat the cancer and we are able to get survival. Meaning that if we catch it in stage 0, stage 1, stage 2, stage 2B, going even up to stage 3, we're still able to achieve cure rates of over 50 to 100%. When we're looking at stage 4 cancer, as much as nowadays we have options to manage it, we are still struggling to get cure rates for that. We do manage it as a chronic illness, but just goes to show you that the earlier you get the cancer, the better your outcomes at the end of the day. Now, we do not know exactly what it is that causes cancer. No one can pinpoint one thing or the other, because even for people who've got genetic mutations, not everyone will develop the cancer. But we do have things called risk factors. Now, risk factors are certain characteristics that will predispose you or increase your chances of getting the breast cancer. And the biggest one, of course, is being female. If you're female, genetic female, then you're at a higher chance of getting breast cancer than genetic males. Unfortunately, the older you are, the more at risk you are. We do see cancer at all age groups, but we see it more common in the older age group, which is about 60 and above. There are inherited genetic mutations that predispose one or one's family to getting cancer. And the most common of these are the BRCA mutations. We have genes called BRCA1 and BRCA2 that could predispose one to getting breast cancer. Sometimes we're not able to test for those mutations. So what we rely on is a family history. So we get a family history of where somebody would report that they have got a history of breast cancer in the family. And then that would lead us to thinking that this family might have a high incidence of probably a genetic mutation. If you have a previous history of breast cancer, remember, most people will have the two breasts. If you have had breast cancer in one breast, the second one is also at a higher risk than the general population to developing breast cancer. Having dense breasts also predisposes one to getting breast cancer, meaning they're less fatty, more dense. Having no children or having your first child after the age of 35 has been proven to be a risk factor for developing breast cancer. Weight gain or being overweight also predisposes one to getting breast cancer, especially in the post-menopausal period. Alcohol consumption, and here we're not just talking about the occasional, beer or glass of wine. We're talking about excessive alcohol consumption, has been shown to predispose one to getting cancer. Smoking cigarettes, whether it's first-hand smoke or second-hand smoke, or even e-cigarettes, those have been shown to predispose one to getting cancer, not just breast cancer, but different types of cancer. And the risk is increased if you're both drinking and smoking. And then for postmenopausal women, when they're getting hormone replacement therapy to help them deal with some of the side effects of menopause, that has been shown to cause an increase in the incidence of breast cancer. And so it's important to talk to your doctor if you're getting hormone replacement therapy regarding your risks versus benefit of taking the treatment. Having a first period before the age of 12 basically means your body overall will have had high exposure to estrogen, which is the female hormone that predisposes you to getting breast cancer. no physical activity, which will lead to being overweight, a sedentary lifestyle that predisposes one to getting breast cancer as well. And then also not breastfeeding has been proven research to be a risk factor for developing breast cancer. Some of the myths and misconceptions that we come across and that we deal with on a day-to-day basis. Yes, you can avoid getting breast cancer. You just need to have some lifestyle changes. So healthy diet, one that is devoid of chemicals, one that is devoid of, fatty foods, devoid, or basically just taking a normal health balanced diet that is more organic, that is good, that's a healthy diet. And then exercise has also been shown to reduce your risk of breast cancer. Reducing alcohol and also cigarettes has been shown to reduce the incidence of breast cancer. So it's not just, talk that we're having here. Large breasts do not increase your risk of getting cancer or breast cancer for that. So any size breasts, you can get breast cancer. So it doesn't matter if they're small, if they're large, if they're loopy, if one is bigger than the other. Everyone should know how their breasts generally feel, but everyone is at risk of getting breast cancer. Using birth control for more than 5 years has been shown to increase the risk of getting breast cancer. And this is basically due to estrogen exposure, and especially for those who have got other predisposing factors towards developing breast cancer. Of course, it's not all birth control, and therefore that's why it's important not to get birth control over the counter. It's important to see your gynecologist so that you can be prescribed the appropriate birth control for yourself and your medical conditions. We've talked about overweight increasing the risk of breast cancer. And then something that, we don't see often, but it does occur. Men can get breast cancer. I think we've always focused on women during the month of October, but about 4% of breast cancers that we see occur in men. And so it's important to also make men aware that their breast tissue, however little it is, could be at risk of developing breast cancer. Something that people always say is that there's a lump, but because it's not growing bigger or painful, it doesn't mean that it's anything. What we say is that if there's a lump that was not there before, even if it's not growing bigger or it's not painful, needs to be looked at by a healthcare professional to ascertain whether it's something that we should be concerned about or not. So we don't need to wait for lumps on our body, whichever part of the body it is, to get bigger or to get painful for us to seek medical attention. And no, breast cancer is not caused by a blow to the breast or biting during breastfeeding. That's a myth, and we should be aware that it's a disease like any other. When we're talking about early detection of cancer, we want to improve the possibility of the treatment being successful and thus cure being achieved at the end of the day. When we're looking at early detection of a disease, we want to catch it in the pre-symptomatic stage as much as possible, meaning that the client would have no reason to seek medical care and would have no symptoms or would feel nothing, but we are able to detect it through different means. The two components of early detection, we're talking about an early diagnosis, but more often than not, we are looking at encouraging screening interventions. So what is screening? It involves applying simple tests or procedures across a healthy population in order to identify unrecognized cancer disease in individuals before they develop symptoms of cancer. So we're not looking to diagnose a cancer, we are looking to catch it, if we can, in the pre-invasive stage. And this is something that we encourage each and every person to do. You need to be aware of your own body, and you need to be able to be screened for the different body parts that you have. Now, we all have breasts, so we need to be able to be screened for our breasts so that we can be able to catch breast cancer in the pre-invasive stage. You do not need to have symptoms, meaning you do not need to feel pain, you do not need to feel a lump in the breast or any of the other symptoms that we shall talk about later. You just need to know, be seen in a healthcare institution or center, be stratified in terms of your risk. Are you somebody who's at a high risk, average risk, or a low risk, depending on the history that they will take? And then they will advise you on the different diagnostic screening methods that we have. So screening by itself usually will not prevent a cancer that was already coming to happen from happening. Screening will prevent it from developing further or will enable us to detect it early. And the benefit where we look at now getting good outcomes is that whatever screening that we do, if we do identify something that is wrong, we must link that to treatment. So we might be able to push the patient on to the queue for the next steps to be able to detect the cancer early. And by detecting the cancer early, we're able to get improved prognosis, meaning we're able to get good outcomes in terms of the cancer. We're able to reduce the mortality and morbidity, and we're able to have a lot more of what we call survivors, which is what we are seeing today. So the screening interventions that we have for breast cancer are various. We have the self-breast exam, and there are different techniques in which you can do the self-breast exam. You can even Google how to do a self-breast exam, but it involves your hand and your breast, being in a comfortable position, choosing a particular time of the month. Usually it's after your period to be able to do it for women, and just going through the entire circumference of your breast, including the nipple and areola area, and being able to check to see that there is no pain, that there is no lump or mass that you feel, and that there is no discharge from the nipple. Now, a clinical breast exam will be done by a healthcare professional. So it will be done by a trained nurse, clinical officer, doctor, and they'll be able to examine the breast even further in more detail, including checking under the arm and towards the neck for any nodes or lumps that could be growing there. Now, when we come to the diagnostic tests that we use for screening, we have different ones. We have an ultrasound. An ultrasound is usually done for younger women, less than 35 years of age. An ultrasound can also be done together with a mammogram to be able to detect any abnormality in the breast. And there's different ways in which the radiologists, there's different things that the radiologists look for when they do the ultrasound. Mammogram is a little bit of an uncomfortable procedure, but it is a very good procedure, and it is done it can be done for all age groups. We mostly recommend it for 35 and above, but it doesn't mean that if you're below the age of 35, it cannot be done. It can, of course, with discussions with your healthcare worker, and it enables us to also detect breast cancer early. A breast MRI is also recommended for people who have got dense breasts, who the mammogram and ultrasound have not been useful or have not gotten conclusive findings. For those who've got implants in their breasts, for those who've had maybe previous treatment in their breasts, including radiotherapy, then we can utilize the breast MRI. So not everyone gets the breast MRI. The key with these screening interventions is if you're going to choose a place to have, say, the mammograms, a particular health facility, it's always important that you stick to that facility as much as possible for future. Because what we would like to do as the healthcare professionals is always go back and compare your previous mammograms to your current mammograms, just to make sure that we can notice any subtle changes if they are there. If you keep changing facilities, it sometimes becomes very difficult to be able to identify those subtle changes that occur on a yearly basis, and thus making it difficult to utilize these interventions as for screening purposes. So as much as possible, stick to the same facility so that you can be able to go through the different diagnostic tests for screening. So what are the signs and symptoms that we see? You can have a lump or a hard knot or a thickening in the breast or under the arm area. You can have a darkening or swelling of the skin or redness of the skin with an associated lump or without an associated lump sometimes. The changes on the nipple, such as a small rash around the nipple, that should be something that should be looked at by a healthcare professional. Change in the size or shape of the breast. Most people will have one breast a little slightly bigger than the other one. But if you start notice, a rapid increase in the size of one breast as compared to the other, or any change in terms of the shape of one breast compared to the other, then it's important that you seek healthcare advice on that. Any dimpling or puckering of the skin in any part of the breast or the nipple area, that should also you should seek intervention for that. We talked about the rash on the nipple, and pulling in of the nipple, meaning instead of the nipple standing out, it goes back inwards, it retracts back inwards into the breast. If that is not how your breasts have been throughout your life, then that should be something of concern. A nipple discharge that starts suddenly, and most times we're talking about a nipple discharge that is bloody. You can have different nipple discharges. So for lactating mothers or mothers that are breastfeeding, you can have milk coming out of the nipple. We have other conditions where you can have a nipple discharge, but the one that we worry about that is ominous would be a bloody nipple discharge. But any nipple discharge you should seek attention just for reassurance as well. And then any pain in the breasts that is on one spot that it does not that is not associated with trauma, you should seek medical attention for that. Many times you may have changes in the breasts and you could seek attention and you're told it is nothing, and you're told to observe it. So it's important to be giving a good history of when you noticed it, what happened to it. For women, does it change with your menses? And then whatever advice you're given in terms of follow-up, you should continue with that. Should the symptoms persist and you're not getting relief despite whatever advice that you've been given, if you're not satisfied, my advice is always seek a second, even a third opinion at the end of the day. So not all breast cancer is the same. So when we identify some of the signs and symptoms that we've talked about and we see that there's a need for us to intervene further, the first step usually is to get a biopsy. Now, a biopsy is getting a little bit of tissue from the afflicted breast, and it's able to be examined under the microscope, and different tests are done to it, and we're able to determine the type of breast cancer that you're dealing with. Again, not all breast cancers are the same, so it's important for us to know the type of breast cancer that you're dealing with. And then when we look at treatment options, we've got, those 5 different treatment options that we can use to be able to treat breast cancer and get cures for breast cancer. One of them is surgery. We have different types of surgeries that can be done. We have those that we are able to get rid of the entire breast, and we're those that we're able to retain some breast tissue. Not all surgical options are amenable to every patient, so it's important to discuss with the surgeon which is amenable to the particular stage and disease that you have. Then chemotherapy, which is medication that is given that goes through the entire body, that is utilized to kill off the cancer cells or potential spread from cancer cells. Radiotherapy, this is X-ray therapy. It is localized to the area where the original disease was, which usually would now be the breast or the chest wall, and the area under the arm, which is the area where the cancer first goes to. And then we've got targeted therapy. So once we identify the type of cancer, breast cancer that one has, if there is any targeted therapy, meaning treatment that we can give to target a particular thing in that breast cancer subtype, then we're able to do that. And then some of the cancers, as part of the targeted therapy, we're able to give hormonal therapy because they may be sensitive to the hormones. And in this case, it's usually the female hormones. So treatment of breast cancer is based on the type of breast cancer that you have. It's also based on the stage of breast cancer that you have. It's based on one's overall health and even age, and if you have any other medical issues. So it's not a standard one size fits all. Each patient is treated in an individual basis, and the treatment is tailored to that particular patient. So in conclusion, we want to create breast health awareness for both men and women. As we've said, it's mostly women that are affected by the breast cancer. We do have a small percentage of men affected by breast cancer. Early detection is key. We cannot overemphasize that enough. And when we're looking at early detection to catch this disease in the pre-invasive stage, then we're looking at screening and screening interventions. And these have to be adapted for age and also for the risk factor that one individual has. And so it's important that you sit with your healthcare provider and they screen you, get a good history for you and identify a risk for you, and then give you a screening program that you can follow. Because in your younger years, you may not need a mammogram annually. You may need one every 2 to 3 years, but as you age, you may need one annually. And then as you get even older, you may even stop doing the mammograms altogether. So age and risk adapted screening is recommended. And then the take-home message is that even if detected, breast cancer is treatable. It is actually curable in many instances, and we have cured so many people of breast cancer, both men and women. And so if we can be able to know our bodies well, be more aware of our breasts, and we can be able to catch this disease early, and we can be able to treat it. Thank you.
Wow, thank you, Daktari. That was a very enlightening presentation. And even as you were going on, you were getting comments on how guys were very happy with the presentation and that it was very informative. I will go straight to the questions in the chat box. I see a few comments. The first is Sibiu saying hi to us from Bungoma County. Hi, Simiu Kizito. And we have two people requesting for the slides, and I'd like to assure all our participants that this is live on our YouTube page. So you and your colleagues will be able to revisit it and get to relearn what Daktari has just narrated for us, and you can be able to share with the rest of your colleagues. We have one question from Suzani. Suzani asks that, hi, Daktari, you mentioned that women who have not given birth are at high risk of breast cancer. Does that mean that women with fertility issues are at high risk, or only those who have no children by choice? This Susan from Uganda. Karibu from Uganda, Susan. Daktari?
Welcome from Uganda. So when we're talking about not having children being a risk factor for developing breast cancer, it is not those with infertility issues. So infertility issues could occur because of different things. But of course, if you're infertile, if you have primary infertility and you've never been able to conceive, then that would put you at that bracket of not having children. And so that increases your risk of developing breast cancer.
All right, thank you for that, Daktari. We have a second question from Humphrey Lutakome. And Humphrey asks, should men look out for the same signs, for the same risk signs?
Yes, definitely. We encourage men as well to do the self-breast exam, to reach out if they notice any of those other symptoms, including pain, changes in the skin color, growth of the breast, rash on the nipple area, retraction of the nipple, any swelling under the arm, then those are signs and symptoms that they should also report so that they can be examined further. So the thing is with men, because they don't have a lot of breast tissue, whatever nodules that or lumps that they get or signs that they get, they tend to notice them early. But because breast cancer is not always on the forefront of their minds, and we all know the health-seeking behaviors of many of our African men, we find that they present late, and they present late maybe because there was no pain, or they just ignored it. The thing with many of these lumps that we see with breast cancer is then when they start out, they're not painful. They're not always painful. And just because they're not painful doesn't mean that it's not anything to worry about. You'd rather go in and be told it is nothing to worry about and be reassured about that than to ignore it and wait for it maybe to grow or start being painful for you to seek medical attention. So the earlier you come in, always the better. The other thing I'd say is that, we are the custodians of our own bodies. We know our body best. Even as much as you come to we as healthcare professionals, you always have to explain to us what it is that is wrong with your body. So if you have something wrong, you feel that it's not right, that it's not the same, it's changed from what it previously was, then we encourage you then to just, seek medical intervention. If there's screening to be done, it will be done. If there's any investigations that need to be undertaken, they will be undertaken. And all this, when we're looking at cancer, is in the drive for early detection.
Asante Daktari. The next question is from Nyawera Gishuki, and she asks, what should women on contraceptives do to avoid cancer?
So contraceptives is always one of those issues which is very tricky because it's not all contraceptives that will predispose you to getting breast cancer. And then it's not all women that will predispose you to getting breast cancer. So when we even talk about contraceptives as a risk, it's just a risk factor. It's not that everyone getting contraceptives will be at a risk of developing a cancer. So my advice would be always sit with your gynecologist, go through your medical history. They will look at your weight, your height, your BMI, your menstrual history cycle, what you're trying to achieve, and they will advise you on the best method in terms of contraception. Whether or not you're getting contraception, you still need to undergo screening at the end of the day. So even while you're on contraception, you will undergo different types of screening. So it is a risk factor, especially for the hormonal ones. We usually would advocate that you just take the conventional contraceptives because we know what dose of drug is in them. There are some that are, herbal and come in as supplements, and the doses of hormones in those are very, very high. So we advocate against them. So my advice would be for contraceptive use, sit with your gynecologist, let them go through your history, let them advise as appropriate, but also as an individual, know that you still have to undergo different screenings at the end of the day. Be it for women, it would be breast and cervical cancer screening.
Asante Daktari for that. Kizito Simiyu is asking if there are any CPD points for professionals. Unfortunately, we're not able to register for CPD points with the continuous medical education bodies, but we keep that in note for next time. Thank you. The next question for you, Daktari, is from Shiro Awori, and she's asking whether there are any preventative measures that we can undertake. And maybe you can tell a few more pointers on lifestyle modification and diet, if any, Daktari.
Yes. So they say prevention is better than cure. And actually, I think that's a message we should be preaching a lot more of, is in terms of prevention before we even get to screening. So prevention, we've talked about the lifestyle modifications that we need to take. This would include, smoking cessation or tobacco cessation in whichever form. We find that not everyone smokes it. Some people sniff it, others, chew it. So we advise against that. The other one would be alcohol use, to limit your alcohol use. And there's the recommended alcohol intake. I think it's 2 units for men and 1 unit for women. I cannot tell you what is in a unit. You can look through that. And then maintaining a healthy weight. So that means being active, more physical activity. When we talk about exercise or active exercise, then we're talking about exercise at least 5 times in a week for at least 30 to 45 minutes. Can't at least 3 times a week is good enough, but you have to get, you have to break out into a sweat when you do this exercise. The other thing we talk about is diet. So eating a healthy, balanced diet. And we have different nutritionists that can take you through that in terms of the foods that you should eat. What are cancer preventative foods? And these are foods that are basically rich in antioxidants, and antioxidants prevent the formation of free radicals, which affect the cells, the DNA of the cells, that could cause changes in the cell that could lead to cancer. So there are different foods that we can eat, healthy foods, foods that are readily available and cheap, that could prevent us also from getting cancer. And then one thing when we talk about prevention is knowing your family. Not many of us are lucky to know our family history, but if you do have people around you, get to know your family history, get to know if anyone who died suddenly, what did they die of, what illnesses do they have, because you can find that you may have a family history of maybe even heart disease, let alone cancer, and it's something that you could do something else to be able to prevent that from happening to you. So getting to know your family history is also important for you.
Thank you, Daktari, for those pointers. We have Humphrey Lutakome was asking, has a concern and is asking for some guidance. He says, for our daughters that have started their periods and are below 12 years, Should he be worried, and should they start some tests?
No, we will not recommend for them to start tests. So the average age would be about 11 to 12 years to start, basically 11 to 13 years to start your period. Some people start earlier than that. We've had cases in Kenya reported of people starting at the age of 8 or 9. What basically this does for you is it increases your estrogen exposure throughout your lifetime, such that if you have a lifespan of about maybe 80, 90 years, it means your active years where you were exposed to a high level of estrogen in your body is higher. And then because of that, that increases your risk of developing breast cancer. So when we're looking at it in terms of early, what we call menarche, starting your periods early, the other thing we look at is also if your periods stay on longer past the ages of menopause. So if they stay on past 55, then that would also be something to worry about, because you've increased the number of times that you've probably been exposed to estrogen. The other thing that we would worry about in terms of estrogen exposure would be the hormone replacement therapy in the postmenopausal setup. That increases, again, your estrogen levels in the body. And then for people who are doing, say, like gender reassignment procedures where they end up taking estrogen, that also increases their risk of breast cancer. So the thing here is not starting the periods starting the periods at 12 is basically being looked at that in your lifespan that you would have an increased risk of developing breast cancer. It doesn't mean that you start doing tests now. It just means that, when you come of age, you start your screening tests appropriately. Yeah. So there should be no worry for now.
Good. Thank you for that clarification. Morias Wanyonyi, he says hello from Eldoret, and he asks, how does hormonal imbalance lead to breast cancer? And also, does testosterone in men a risk factor or a causal factor for breast cancer?
So I wouldn't say hormonal imbalance leads to breast cancer, because you can have hormonal imbalance for different reasons, including thyroid problems and things like that. So hormonal imbalance doesn't per se cause an increase in breast cancer. What we'd say is prolonged exposure to estrogens does increase your risk of developing breast cancer. Testosterone would be a factor that would reduce your incidence of getting breast cancer, such that for men who we find would have an extra X chromosome, meaning they have higher estrogen levels, then you find for those men, they could be at a higher risk of developing breast cancer. Generally, testosterone is protective. And the reason I'd say that is also because we find that for those who are doing gender reassignment procedures and are men and are now taking estrogen, would be at a higher risk than the general population of men for developing breast cancer as well. So hormonal imbalance per se is not a risk factor for developing breast cancer. Testosterone is not a causal factor for breast cancer in men. And so we should not worry about it.
Thank you. We have Julian Namale asking for the presentation. Julian, the presentation is on YouTube live right now, and you can go and see it after. You'll not only get the presentation by Daktari, but also hear how she's been able to answer all these questions that we are answering right now. The next question is from Kizito Simiu. Kizito Simiu is asking whether there's an impact of human papilloma virus vaccination on breast cancer.
So human HPV, so the human papilloma virus, this is a virus that has been shown to lead to different cancers. Of note would be cervical cancer, and then it can also be shown to lead to other cancers. So we have anal cancer, we've got different head and neck cancers as well. It happens over years of the HPV infection happening. The vaccine that is given is to try and prevent the progression to cancer. And most of the times here, we are talking about cervical cancer. So we, as a country, we have rolled out a vaccination program for HPV for young girls, and that is taking place. And it is hoped that it will be rolled out for more age groups and even for boys in future. And the aim is to one day have a cervical cancer-free world. And it's a slow process, but we shall get there. If we kick polio out of Africa, I'm sure this one shall also happen for HPV vaccination. Yes.
Yeah, Sante. Caroline Musyoka shares her gratitude. She says, "Thank you, Dr. Helen, for the great presentation." And then she goes ahead and asks, "Are there family planning methods that are likely to cause breast cancer?"
So there are no family planning methods that are likely to cause breast cancer, but there are family planning methods that could be risk factors for developing breast cancer if you are a person that is predisposed. And that is why I will reiterate again that when you're using hormonal contraception, don't just get it over the counter. Please sit with your gynecologist, have a talk with them, and let them go through the risks and benefits of the different contraceptive methods and what is appropriate for you at your particular age and what you desire in terms of contraception.
Thank you. The next question is from Lavender, and she asks, "Do women with several breast lumps, and that is the cystic breast, have higher chances of developing breast cancer? Also, where or why do these lumps come from?"
Okay. So breasts are not per se smooth. They feel a little bit grainy. They feel like there's little bags of rice inside them. Those would be the different lobules that you would feel when you're feeling your breasts. With different individuals, we talked about different types of growth. So we talked about those that are cancerous, those that are not cancerous. So we have some benign growths, the ones that are not cancerous, that occur in women of different age groups and even in men as well. And they would be no cause for alarm, and they mostly occur in younger women. So either in your adolescence or your early 20s, 30s, we see that. So it's not that, having cystic breasts would predispose you to getting that. I'm also not sure what you mean by cystic breasts, because a cyst is basically a fluid-filled cavity. So having little bumps, there's the normal grainy texture of the breast, but having a lump or a bump that you can feel, you'd rather go and have it looked at so that you can tell whether it's something to worry about or not. And when they do the ultrasound or the mammogram, there are different characteristics that they look at. And of course, there's always a watching schedule that you're given. If you're told that it's nothing to worry about, there's also the option of taking it out should you require to have it taken out for whatever reason. There are those ones that we leave and we do not interfere with, and one goes on with their normal day-to-day life very healthily and without any problems. Having cysts in the breast is not common. If you do have cysts in the breast, it's important that you have that looked at. There are different conditions that would predispose one to a higher risk of developing breast cancer. So sometimes they do biopsies, check if that is one of the risks, then they will be able to advise you on what to do. But lumps and bumps, where they come from, the body is a weird and wonderful thing. Sometimes some things grow, they might not always be cancer. But if you do have any growth that you're worried about, please seek medical attention.
Thank you for clarifying that well, Dr. Kiziti Sumiyu is requesting for more clarification, especially on the issue of bras, wearing bras and breast cancer.
So there was one, I think there was a study done in Kenya at some point that was trying to say that, having no bra prevents you from getting breast cancer. But I don't think that has been proven, even in studies outside of the country. Bras do not increase or decrease your risk of developing cancer either way. So you can spot a bra, there should be no problem. You shouldn't be worried about it. Of course, definitely getting one that fits well is important. Because we don't want to create, friction on the skin or whatever that will cause inflammation.
Thank you. Suzanne also thanks you, Dr. for the presentation, and she asks the question, is it true that taking plastic bottled water that has been exposed to either heat or ice may lead to breast cancer?
So there've been those concerns that different plastics would emit different chemicals, dioxins, that could lead to the formation of mutations in cells and could lead to the formation of cancer. And I think that has been proven in some research, though not on a large scale, but they do say that if you're utilizing plastics for food, whether you're storing food, room temperature in the fridge, or using it to heat in the microwave, that you utilize plastics that are BPA free, so that you don't have chances of those chemicals leaking out into whatever food you're going to ingest. So yes, good plastics, they are good plastics and they're bad plastics. And I think Kenya is one of those countries that has taken a huge stance against plastics, and we commend the government for that. But we still have the hard plastics that we utilize for food, so we always need to make sure that they're BPA free.
Thank you, Daktari. We have a comment from Moses Ngari, and he thanks you for this educative discussion. And he also echoes your comments that early detection is key as a preventative measure with any major or minor ailments. The next question is from Gaudensia Kamala, and she also thanks you for the presentation. And she asks, what are the risk factors of a patient going through unlimited sessions of chemotherapy?
I don't think we have anything like unlimited sessions of chemotherapy. We may have the standard conventional chemotherapy that we give, that we have different cycles for. So we have different regimens for chemotherapy, and they all have a timeline. When we have patients who have got stage 4 disease, and we're giving them treatment to maintain or control the disease and suppress it and prevent it from spreading any further, then a patient may be put on treatment, which could be chemotherapy, for a prolonged period of time, or targeted therapy for a prolonged period of time. But it's not unlimited, because we always have to reevaluate the patient to see how well they're responding or how well they're doing. So I'm a bit hesitant to answer your question, because maybe I do not understand what you mean by unlimited sessions of chemotherapy.
Okay. Now, our last question is from Suzani, and who she asks, does the presence of lipomas increase the risk of cancer?
So lipomas, for those who don't know, a lipoma is a growth on the body that is a growth of fat cells. So it's an abnormal proliferation of fat cells anywhere in the body. That's what we would call a lipoma. When I talked about tumors, remember I talked about the ones that are cancerous or malignant and the ones that are benign or non-cancerous. So a lipoma would fall in the group that is non-cancerous. It is benign, meaning that it doesn't have the ability to spread from one part of the body to another. It will just grow wherever it is, and it's usually very, very slow growing. So it doesn't increase your risk of developing cancer. It's a benign growth. We do watch them. If they do start to grow for whatever particular reason, then we do investigate them further. But for more often than not, we just tend to watch lipomas.
Asante. Next I'd like to address a comment from Jacqueline. She's requesting whether she can get the presentation. Jacqueline, this is on live on YouTube, and it will be there, Daktari's presentation, and this discussion, very interactive discussion, will also be there on YouTube. From YouTube, we have a question from Sophia Wisdom, and she asks on whether, Daktari, you can touch on a bit of the side effects of chemotherapy and how to handle them. This is in line with treatment of breast cancer.
Okay, so chemotherapy we talked about is medication that we give for the treatment of breast cancer. It can be given before patient undergoes surgery. It can be given after patient undergoes surgery. It can be given when the cancer comes back as well. So we have different types of chemotherapy. We have oral chemotherapy. We've also got IV chemotherapy. Many times we tend to use the IV chemotherapy when you're talking about breast cancer, but we do have options for oral chemotherapy. Then when we talk about targeted therapy, we also have oral options that we can be able to use. Or hormonal therapy, we have oral options that we use for breast cancer. So the side effects depends on the drug that is being given. Not all drugs have got the same side effects, but generally the common side effects of chemotherapy when we're treating breast cancer would be hair loss or alopecia. Patients tend to lose their hair, but it grows back after the treatment is over. Could be skin changes where the skin could darken in terms of the complexion. Nail changes, the nails could also darken. Blood counts could go down because it can suppress the bone marrow. So we have, you can have different lines in the blood counts that we look at going down. You can have nausea as a side effect of treatment, have vomiting as a side effect of treatment, can have fatigue as a side effect of treatment. One of the psychological things that happens is something they call chemo brain or brain fog. So some forgetfulness also happens when patients are undergoing chemotherapy. Those are generalized side effects of treatment. The rest would be specific to the particular treatment. Some things like numbness or pain in the fingers and the toes could occur with some of the chemotherapy as well.
All right, thank you for that clarification on the side effects. We have Makori Henderson. Makori Henderson thanks you, Daktari, for the good presentation, and he asks, why is there bleeding for the patients of breast cancer in the nipple?
So not all breast cancers will have a nipple discharge. Some of them will have a nipple discharge, either as part of the presentation to the breast cancer, or will have a nipple discharge, on examination, one that might not have been noticed even by the patient before. So it's because of the disease, you find that, it's affecting either the ducts, the ducts also have some blood vessels, small capillaries. So that could be one of the things that could have gone into a vessel, and then that could be also one of the things that why we get a nipple discharge that is bloody. Most of the time it's just because it's affecting the duct and the small capillaries that get the bloody discharge from the nipples.
Thank you, Daktari. We have Rose Karaoke and Irene Osoro who are sharing their gratitude. They say, thank you, Dr. Helen, for that session. It was very interesting, impactful, and very informative. And the next question is from Regina Kawera. She asks, for the pregnant and breastfeeding mothers, do they still need to do a breast exam? And after what period post-delivery?
And thank you, Kawera, for that question, because one of the most neglected population is the pregnant and breastfeeding mothers, especially when it comes to breast cancer. And we struggle a lot because many times they're dismissed because of the different breast changes that occur during pregnancy and also during breastfeeding. So the breast exams should start from the word go. Even when you're pregnant, you should still have a breast exam, always check for any lump. And even when you're breastfeeding, for the breastfeeding mothers, you'll say that you notice the child maybe does not breastfeed from one breast, prefers the other, and there's a lump. Have it be looked at. More, common things that we say occur more commonly. It could not be cancer. It could be something like mastitis. It could be a cyst of milk in the breast. Now here's where we come up with the cyst. But in some instances, we do find cancer in the breast, and especially those ones that respond to the female hormones. We see that they tend to grow quite rapidly when one is pregnant or breastfeeding. So breast examinations should start from all the way from pregnancy, even when you're lactating, breastfeeding. You should continue with your breast exams. You may not do per se successful mammograms at that point in time, but you can still do ultrasounds if you need assessment or the MRI.
Thank you. The next question is from Eric Ongwen. And he asks, first of all, he thanks you for the presentation, Daktari, and then he asks, can breast cancer lead to persistent ascites in the abdomen?
So when we get ascites that is associated with breast cancer, it is an instance where the cancer has now spread from the general breast area to a different part of the body, which would be the cavity that houses the stomach, liver, kidneys, that's the abdomen. So fluid that accumulates there, that is what we call ascites. And you can have ascites for different reasons. You can have ascites maybe due to cardiac problems, liver problems, but you can also have ascites due to spread of a cancer to that area. And so when this fluid accumulates there, we call it malignant ascites, and that is generally stage 4 cancer. And yes, ascites can accumulate at different rates for different people, and just depends on then how we try to tackle it. Some of it could respond to chemotherapy. Sometimes it's a lot. We need to do an immediate intervention where we actually take out some of that fluid just for the patients to have some relief. But generally, they need treatment to fix the entire body. So most of the times, we do either targeted therapy or chemotherapy to be able to manage that. But yes, it can occur if the cancer spreads to that.
Asante. The next question is from Priska Bet, who, after thanking you for the good presentation, Daktari, saying that it was quite informative, she asks whether one can get breast cancer for not breastfeeding after giving birth.
It has been shown. I mean, we have different studies that do tell us that not breastfeeding increases your risk of developing breast cancer, and it basically just has to do with the changes that happen in the ducts as well. So that has been shown to be a risk factor. For those who don't get children, nulliparity, just also that risk of not getting children and also not breastfeeding does increase, and it all has to do with the hormones. So the surge of the estrogen, progesterone that occurs in the body, that would lead to that risk factor. Now, it's a risk factor. Remember, a risk factor is something that could increase your chances, but it's not an absolute indication that you will develop the breast cancer.
Thank you. Catherine Mutemi says, thank you, Daktari, for that good presentation. She has learned a lot. And she says in one of the slides, it's indicated that persons who are above 35 and may not have kids are more exposed to breast cancer, since it's related to too much exposure to estrogen over time. And she says, how can one address this if they're already 35 years of age?
So it's not per se, it all has to do with hormones, but it's not per se linked to the estrogen surge at the end of the day. It's just that there's been different studies that have been done and that looked at different women at different ages. And they found that those that did not give birth had a higher risk of developing breast cancer. And those that gave birth, after the age of 35 also had a higher risk of developing breast cancer. Women who gave birth the first time below the age of 25 had, I think, the lowest risk of developing breast cancer. But it's just, here we're just talking about risk factors. So they're just different studies that have been done, modeling it, looking at these women and looking at those that would be a risk factor. And it's found that for those that did not give birth, for those that gave birth much later, would have an approximately twofold increase of developing breast cancers compared to those that give birth much earlier, before the age of 25 years.
Thank you, Dr. for that clarification. We have a comment from Godencia Kamala that maybe you can address, Dr. She says that from her observation, patients who go to chemotherapy, most of them gradually deteriorate until they eventually die, and there's a very small survival rate percentage.
I'd say it's a sorry observation. It's a sad situation. If that has been your experience with chemotherapy, I'd say a few years ago, probably maybe like 10 years ago, many of the cancer patients we used to see would succumb to their illness, and everyone probably has a personal story. You are always affected, and not everyone has a positive experience of cancer. But I'd say that a lot of the patients that we're seeing now, we are tending to get the cancer a lot earlier. And patients are going through their treatment. Not all of them tolerate it well, but patients are going through their treatment and they're surviving. We get a lot more noise, I'd say, from those that pass away, and because it's painful. I mean, it's a loved one that has passed away, and we have their memories and everything. We have I'd tell you, we have very many that are surviving, that have been treated locally in this country, that are alive, that are doing well, and are going about their day-to-day business. So the survival rate is not dependent on the chemotherapy in any way, shape, or form. The survival rate is dependent on the other factors that we talked about. The type of breast cancer that you have, the stage of breast cancer that you have, if you've got appropriate treatment, and appropriate treatment will be looking at even the surgery that is done and how it is done, the treatment that you got when you got it, was it in a timely fashion, and did you complete all your treatment? But we are seeing patients surviving, even patients in stage 3 surviving the cancer. We have patients in stage 4 who, I can tell you, our lady, the last 4.5 years has had stage 4 cancer and is doing well. She's not she's maybe an exception to the rule, but the message here is that it doesn't matter your stage of your cancer, it matters the treatment that you get and how you access the treatment. So it's important for you to undergo evaluation. We get to know the type of breast cancer that you have, the stage of breast cancer that you have. We give you a treatment plan that you can follow, and then we can be able to get you successful in treatment. Treatment sometimes is harsh on the body, but it's not something that one is not able to tolerate. We're able to give different things to counter the side effects of some of the medications that we have. The patients are able to go through treatment. You can see she's asking, is chemotherapy still under research? All treatment is always under research. There's the research that is done to develop the medication, and then there's the research that is also done once the medication is out in terms of post-market research on medications. But I would not say that chemotherapy is under research in terms of it being useful to treat. And that is why we continue to use it. And when used appropriately, it is safe to give to patients.
Thank you. Humphrey Lutakome asks if possibly you can highlight the benefits of targeted therapy over chemotherapy, if any.
So thank you for that question. So targeted therapy is different. So when we're talking about targeted therapy for breast cancer, then we're looking at some of the newer molecules that we have, and we're also looking at hormonal therapy. So for hormonal therapy, depending on the type of hormonal therapy that you're giving, some of them affect the bones, could weaken the bones a little bit, especially for those that are beyond menopause. So could cause some muscle aches as well. And then there's one that could increase your risk of getting, say, a clot in the body, could cause some visual disturbances. Then when we're talking about some of the targeted agents in terms of for breast cancer, there's one that could cause some heart effects. So we always check the heart to make sure that it's fine. There's others that can cause, bone marrow suppression, so the blood levels can come down, would cause maybe a rash on the body. So what you find with the targeted agents is that they won't cause your typical symptoms that conventional chemotherapy would have. So your hair may not fall off. You may not get that excessive nausea and vomiting that we see. You may not get the skin changes in terms of the nail changes, the peripheral, the pain in the fingers and the toes, but you will have other side effects. No treatment is without side effects. And side effects vary from individual to individual. There are those who will experience minimal side effects, and with the same dose, somebody else could be having the more severe side effects. So you cannot tell how you will respond to a treatment until you start it. But it's always important to be aware of the side effects.
Thank you. Peter Ipapo asked the next questions, and she asks, what is the percentage of men with breast cancer in Kenya today, if you know, Dr.
So in Kenya, our statistics are not 100%, the true picture of what we have, because we don't have everyone with breast cancer being reported as we should. And so what we do is extrapolations for the breast cancer. I would not be able to give you the exact incidence of breast cancer in men in Kenya today, but generally, globally, the incidence of breast cancer in men is about 1 to 4%. So they usually say it's about up to 4% will occur in men, and the rest 96% is occur in genetic females.
Asante. I see our final question is from Betsiba Musoli, and she thanks you, Dr. for the presentation, and asks, at what stage is breast cancer likely to be cured?
I'd like to go back. Let me just see if I can get that slide again, so we can just show you thoroughly. Even though this is an old one, but we are curing cancer stage 1, stage 2, stage 3, and stage 4. We're getting good cure rates. So just get up. There we go. This is an old slide, probably a couple of years old. It might be better for now. But when we're looking at it in terms of 5-year survival rates, not even going into 10 years, but just the immediate 5 years post-treatment, which is how we follow up intensively for the first 5 years. We're seeing up to 50% rates, even in stage 3 cancer or breast cancer. So we're getting very good cure rates. Of course, the best cure rates would be if you get it in stage 1 and 2. And when we're getting to stage 3, we are still getting cure rates, but they're not as great as when we're talking about stage 1 and 2. The other thing to remember is your cure rate, as much as we're talking about stage 1 and 2 and 3, the type of breast cancer also determines how well you will do. So if you have a more favorable type of breast cancer, even if you're stage 4, you may probably still do quite well in terms of survival, as compared to somebody who might have a stage 2 breast cancer, but it's a very aggressive breast cancer. So the type of breast cancer also has influences how well one does. And the treatments one gets also influences. So when we're talking about cure, it's not a one-off thing in terms of stage. Stage is not a determination of cure. It's a good indication of how well one will do, but the type of breast cancer one has and the treatments that one gets, in coupled with the stage, would be a better indication to tell us about cure. But the take-home message is we are able to achieve cure for breast cancer if you get appropriate treatment and timely treatment.
Asante, Daktari. That was our final questions. I don't know if, Daktari, you have any final comments before we close.
So thank you very much for the invitation once more, and thank you for being engaging and asking the questions. I have tried to answer them to the best of my ability. There's a lot of information and resources out there that you can look at in terms of cancer awareness and even cancer screening and even the different treatment options that you have. Just to remind you again, you're the custodian of your own body. As much as possible, you should be aware of any lumps, bumps, anything abnormal, have that looked at. Screening, we try to emphasize it in the month of October, but screening can take place any time of the year. So choose a date, pick your birthday, give yourself a present, go get screened for whatever body parts that you have that can be screened for cancer. Remember, we cannot screen for all the cancers. And yeah, stay safe and stay healthy.
Thank you so much for those final comments. Dr. If they wanted to reach you, to see you, or to talk to you, how can they reach you and where can you be found?
I work at the Kenyatta University Teaching, Research and Referral Hospital in Kenya. So they can always call the toll-free number there. It's 1558, and they can book appointments through that number.
Thank you, Daktari. And with that, we are 34 minutes to spare to the end of our session. I would like to thank you all participants for taking time to join in to the webinar. You're the ones who make the webinar a success. And I'd like to thank Daktari again for graciously giving her time and sharing her knowledge with us. Again, I would like also to ask our participants if you need to get more information, to hear more of what Daktari discussed in terms of answering the questions or her presentation. You can find this in YouTube. It is live right now, and I'm sure it will be there even afterwards on the Britam YouTube page. Last but not least, I would like to thank the team that has made this possible. Our planning team at Britam, our social media team, Wilson Rienye, our marketing team, our IT team, and this is all led by the head of Britam Health, David Obonyo. And with that, asanteni sana. Have a blessed afternoon ahead.